Hello, I'm Dr. Campbell from the Priory Hospital. Well, many people may have a familial tendency to be depressed, but these days more and more we see depression caused by stress, particularly stress of work and other stresses in life such as marriage and relationship problems. I find in my practice more and more people at work are being asked to work too much, too long and too hard and continue to do that. They begin by feeling stressed, anxious and insidiously become depressed. As people become more and more depressed, they're really unable to function because they feel so sad and not enjoying things that they normally enjoy and feeling so negative that they're just not able to do what they used to do, either at work or at home. Depression affects everybody from all levels of society. It's not selective about colour, class, gender or anything else. Anybody can be susceptible to depression. Yes, there are. Some depression arises from identifiable causes, i.e. stresses at work or stresses within relationships, but other depression can arise for no reason, and often people feel very guilty because their life on the surface seems to be okay, but in fact they become more and more insidiously depressed. Very often people seek help from those around them, particularly those close to them, like husband, wife, children, parents, say to them, really you're not your normal self. I think you're a bit depressed or you need to do something about this. Frequently, patients don't recognize themselves to be depressed until someone else who cares for them says something. In seeking help for depression, most patients will go to their general practitioner first, although sometimes they may not want to see the GP for a variety of reasons, may want to come directly to a consultant psychiatrist, which many consultants at the Priory Group will do. So the responsibility of the consultant psychiatrist is to make a diagnosis, i.e. what's wrong with you, and secondly, what to do about it. And the what to do about it will usually be number one, an experienced therapist, and secondly, may or may not involve medication. I think the most important point to make is that depression is a treatable condition. Once you've recognised that there's a problem, something can be done about it. The effectiveness of a combination of therapy and medication is extremely high. The research and our experience shows that the most effective treatment for depression is a combination of a good psychotherapist and medication. What the Priory offers is rapid access to an experienced consultant psychiatrist and follow up by that psychiatrist, not a junior doctor. Rapid access to an experienced therapist and follow up by them, and recommendation of medication if necessary. If the depressive illness is severe enough, patients may need to be admitted to hospital for more intensive treatment. This is usually for 2 or 3 weeks. We know that the effect of depression on people's lives can be enormous, on their relationships, on their work and all other aspects of their existence. So effective treatment for depression brings them back to a normality and they can lead a normal life. Antidepressants usually take a few weeks to take effect. The side effects of modern antidepressants are fairly low, they're very well tolerated, and once they've been effective and start to work, you need to be on them for 6 to 9 months after they start working, so that's usually 10 to 12 months in total. Psychotherapy with an experienced therapist is usually 6 to 12 sessions, maybe longer depending on the nature of the problem. The advantage of having a private therapist is that if you need top-up sessions in the future over the next few months or years, you can do that. You can see the same person. Our follow-up statistics show that 86% of Priory inpatients show an improvement in their mental well-being after admission. I think my most important thing to say is that depression is treatable and it's avoidable. So a good work-life balance, a healthy diet, exercise and not drinking too much will keep you well and not depressed.